Hi everybody, Dr. Todd here, and I want to take a minute to explain to you the importance of ice. Ice is used as an anti-inflammatory to decrease the swelling or inflammation in the disc and the tissues surrounding the disc, which can be muscle, tendon, ligament. All of that stuff can get inflamed when you have a problem in the spine, and it can even get inflamed in the process of going through and correcting your spine. So a very important time to ice is following a first couple of adjustments, but also every single visit of any sort of spinal remodeling traction. So any sort of traction done in the office, following that within 5 minutes of coming off the equipment, best case scenario is to get ice on for at least 5 to 10 minutes following that traction appointment, and here's why. Let's say that we're doing traction on the neck to change the curve. This is a nice curve in the neck. Let's say yours doesn't look so nice, and it's like this. It's been in this position for a long time. The tissues are accustomed to being like this. Now we are doing traction. So you've done warm-up exercises, maybe you were adjusted on that same visit, and now we're doing traction. So we're using equipment to actually stretch and trying to deform the shape of those deep ligaments, muscles, and tissues to correct this type of curvature. Well, in the process of doing that, tissues are going to get inflamed. Sometimes you won't feel it, you won't get all that sore at all. It is crucial and it is important so that you get the best results possible to get ice on the spine within 5 minutes. You grab this out of the freezer and you throw this inside of the sleeve. You never want to put the ice on the surface of the skin. You want to make sure there's at least a thin layer of cloth protecting the ice from the skin. Without a cover, you can cause frostbite over time and you can actually damage the skin. This thin layer of cloth prevents you from doing that. Now, after we've done traction, within 5 minutes, you want to get ice on that area. The ice helps calm the tissues down. It prevents you from getting really sore. This is for your benefit. This is to ensure that you're able to do your home care without excessive soreness, and to make sure that on your next visit, you're able to do traction and even push the same amount or maybe even a little further without having an issue. Please understand that saying that you're going to ice when you get home is only something that works if you live at Subway. Meaning, if you can walk out the door and have ice on you within, like I said, 5 minutes, then you can be one of those rare people that can ice at home. The reason that we've structured our clinic in such a way to have multiple ice packs, to have areas for you to ice, to have these protocols to track this, is because it's part of the system. Make sure that you plan enough time in your visit that you have at least 5 minutes after you complete your traction to ice in the office. Thank you for watching this brief video of the importance of icing, what it does, and why it is imperative to do every single visit after you do traction in the office, unless you live at Subway. We'll see you next time.